amount of blood flow to the kidney. The causes of pre-renal azotemia, anything that causes pre-renal azotemia, anything that causes renal hypoperfusion is the one that causes pre-renal azotemia. What do you think will cause renal hypoperfusion? What do you think will cause decreased amount of blood flow to the kidney? Number one, we have what? Hypovolemia. Hypovolemia secondary to sweating. Hypovolemia secondary to dehydration. Hypovolemia secondary to diarrhea. Hypovolemia secondary to vomiting. Hypovolemia secondary to hemorrhage. Number two, we have hypotension. Hypotension secondary to septic shock. Hypotension secondary to cardiogenic shock. Hypotension secondary to neurogenic shock. Hypotension secondary to anaphylactic shock. Then number three, we have decreased cardiac output. Decreased cardiac output secondary to hypertension. Decreased cardiac output secondary to heart failure. Decreased cardiac output secondary to arrhythmia. Then number four, we have decreased albumin level. Decreased albumin level will also cause what? Will also cause decreased amount of blood flow to the what? To the kidney. So anything that cause renal hypoperfusion, will cause pre-renal azotemia. I hope you get me. So as a result of decreased amount of blood flow to the kidney, there will be less amount of blood flow to the glomerulus. Because of this less amount of blood flow to the glomerulus, there will be less amount of blood that will be filtered by the glomerulus. So because of this less amount of blood that will be filtered by the glomerulus, there will be what? There will be decrease in glomerular filtration pressure. Because less amount of blood flow to the glomerulus will cause less amount of blood to be filtered by the glomerulus. Less amount of blood to be filtered by the glomerulus will cause decreased glomerular filtration pressure, which is called GFR, decreased glomerular filtration rate. So decreased glomerular filtration rate will cause accumulation of nitrogenous waste product within the blood, which is called what? BUN, blood urea nitrogen. And also it will cause decreased amount of urine, which is called what? Oliguria. You will see the patient, what amount of blood or what amount of urine shall we call oliguria? Is when the amount of urine is less than 200 ml. That is what we call oliguria.